welcome. My name is Brenda Scott. I am a commissioner with the Riverside County Behavioral Health Commission. The Behavioral Health Commission is an advisory body composed of volunteers appointed by the Board of Supervisors who work in conjunction with the Riverside University Health System, Behavioral Health, to ensure citizen and professional involvement in all aspects of department services. This video is designed to seek your input as a stakeholder in behavioral health care in Riverside County. Every year, California counties develop planning documents that identify mental health programs and services to be funded by the Mental Health Services Act, also known as MISA, or MHSA, a voter-approved proposition from 2004. That proposition was written to include meaningful participation from the community. We encourage everyone to provide input. This video includes speakers who will give you an overview of the Mental Health Services Act, plan highlights, changes, and program goals developed out of stakeholder input just like yours. When this video is posted, it'll include a link to the entire draft plan and to a toolkit of plan summary materials. You will also find a feedback form that can be completed and submitted electronically. For those wishing to provide oral comments instead, this post also includes an MHSA feedback telephone voicemail number that allows you to leave recorded feedback. The Behavioral Health Commission will ensure that all stakeholders have an opportunity to be heard and that all comments provided electronically or as a voicemail message will be recorded and become a part of the public record. The Behavioral Health Commission will review all the comments and recommend changes to the draft plan if necessary based on the comments received. Thank you for joining us today. Together we can improve opportunities for a healthier, more resilient Riverside County. Please share this video with anyone you know who cares about mental health programs in Riverside County. Each of the following speakers will introduce themselves before they provide you with their overview. Be well, stay safe.
Thank you, Brenda. My name is David Scholin. I'm a clinical therapist and the Mental Health Services Act Administrator for Riverside County. My job is to ensure Riverside's compliance with the Mental Health Services Act, otherwise known as MHSA or MISA for short. The Mental Health Services Act was a ballot measure passed by California voters in November of 2004 that provided specific funding for public mental health services. The Act imposed a 1% taxation on personal income exceeding $1 million. This funding provided for the expansion and transformation of the public mental health service system with the expectation to achieve results such as a reduction in incarcerations, school failures, unemployment, and homelessness for individuals with severe mental illness. If you have an interest in the public behavioral health care system in Riverside County, you are a stakeholder. An important part of MHSA compliance is ensuring an active stakeholder process where you and people like you can provide feedback on sustaining programs, developing programs, or changing programs in Riverside's MISA plan. This video will serve as an introduction and an orientation to the MHSA plan. This year's plan is a new 3-year plan that not only includes plan progress reports, but also some goals for the next 3 years. After you listen to this video, you can click on the links embedded with this post and read about the plan in more detail and how to provide written feedback. You can also give verbal feedback by calling the MHSA feedback voicemail using the phone number also posted with this video. Or you can attend a regional in-person public hearing being held during this time. Times and locations have also been added to this video. MHSA is only one of the funding streams for Riverside University Health System Behavioral Health, or RUHS-BH. The MHSA plan does not represent all of the public behavioral health services in Riverside County, and it is not meant to function as a guide to all the services available. Not all services can be funded under the MHSA. MHSA is divided into 5 components, almost like chapters in a book. Each component addresses a different area of the public mental health service system, and each has its own rules and regulations. As we introduce each component to you, we will also give you some related plan highlights. First up is the Community Services and Supports component, or CSS for short. Community Services and Supports, or CSS, is the largest component in MHSA and receives the most amount of money. It is designed to meet behavioral health needs for each age group: kids, transitional age youth, ages 16 to 25, adults, and older adults, when other funding sources are not available. CSS expands the service system to include evidence-based practices, which are therapies with proven success that are typically too expensive to bring to the public sector, and peer support services, which are services provided by specially trained people who carry a mental health diagnosis, are the parents of minor children in the behavioral health care system, or a family member of an adult who has a mental health challenge, and are hired to coach coping and wellness management from a place of lived experience. Some updates to this year's MHSA plan include: we have improved outreach and engagement to clients in acute psychiatric hospital care settings by connecting them to FSP services prior to hospital discharge. This starts engagement and wraps care around the client before they leave the hospital. We have provided assistant outpatient treatment as a part of Laura's Law for consumers who present as a danger to self or others and who have had difficulty utilizing voluntary behavioral health care services. Referrals are vetted for court review, and the court can mandate outpatient services for 6 months. The department's new life clinics are the primary providers for Laura's Law consumers. We have developed more new apartment units with supportive services for homeless consumers with severe mental health challenges. In 2023 alone, a total of 63 dedicated units are planned or have been completed in Riverside, and 30 units are planned in the city of Corona. Parent Support and Training is a peer support program managed and run by parents who have had a child in the behavioral health care service system. They provide direct one-to-one support to parents and also offer family education classes in the community. Services have expanded to include a new social emotional wellness group for children, a new curriculum specifically for fathers, and the inclusion of parent partners in the juvenile justice system. Now, to tell you more about the next MHSA component is Diana Gutierrez, the Manager of Prevention and Early Intervention.
Hi, my name is Diana Gutierrez. I'm the Prevention and Early Intervention Manager with Riverside University Health System Behavioral Health. The Prevention and Early Intervention component, or PEI for short, is unique in that it provides education and engagement to the general community, whereas CSS is designed to address service needs of people with serious mental illness. It's designed to reduce stigma related to seeking behavioral health care and to reduce discrimination against people who carry a diagnosis. The intent of PEI is to engage individuals before the development of serious mental illness or serious emotional disturbance, or to alleviate the need for additional or extended mental health treatment. PEI is largely outreach-based. Programs and providers are typically in the community at natural gathering spaces. The impacts of COVID continued into the last fiscal year. However, providers were able to offer more in-person services in the community. Many community members also requested and received virtual options as well. Riverside County has 7 work plans, or areas of concentrated need, with several programs and services in each. PEI providers continue to show success in meeting program goals and objectives and reaching their target populations. Today, I'll provide you with updates within some of those work plans. Work Plan 1, Mental Health Outreach, Awareness, and Stigma Reduction. This includes several different strategies that focus on mental health stigma reduction, education about mental health symptoms, and increasing access for high-risk or traditionally underserved communities. These communities in Riverside are the Hispanic Latinx, African American, Asian Pacific Islander, Native American, U.S. military veterans, LGBTQ+, deaf and hard of hearing, Middle Eastern North African, faith-based communities, and people with disabilities. Community mental health promoters are people from these respective communities who've been trained to outreach and discuss behavioral health care within their communities. Despite COVID impacts, providers engaged with over 7,000 community members, delivering information on behavioral health topics ranging from self-care to understanding serious mental illness. PEI also funds the administration and activities under our Cultural Competency Unit. Now we'll hear from Michelle Downs, the new manager of the Cultural Competency Program, for more information.
Thank you, Diana. Hello, Riversiders. I'm Michelle Downs, and I am the new manager of the Cultural Competency Program. The goal of cultural competency is to understand the current and historical factors that have impacted access to care for traditionally underserved and high-risk communities so that barriers to accessing care can be eliminated. We believe that everyone in Riverside County can lead well and productive lives. This last fiscal year, cultural competency improved our service delivery infrastructure as well as our goals as defined in the California State Required Cultural Competency Plan. Staffing expanded and Riverside's plan has been more defined to ensure inclusion of our substance use and prevention programs. Cultural community liaisons were contracted or hired to serve the communities that Diana identified in her PEI update. These liaisons develop relationships with grassroots organizations, places of worship, and proprietors of natural community gathering places. They problem-solve care access and service disparities issues countywide. The liaisons have developed and chaired their respective community advisory groups, which are open to committed and interested members of Riverside County and also serve as a regular forum for behavioral health education and service feedback. Several liaisons were pivotal in providing additional support, coordination, and education to the city of Blythe and surrounding areas. RUHS Behavioral Health has made concentrated effort last year to work with local stakeholders and community organizations to improve service access in this remote area of the county. Now, back to Diana to continue the highlights of the PEI plan.
PEI launched a new website that can be found at www.rcdmh.org/MHSA/PEI. The PEI page includes comprehensive information about prevention and early intervention and the variety of services available to the community. The PEI page includes up-to-date contract provider information as well as our PEI training calendar with easy electronic training registration. PEI administration continued to conduct trainings virtually and in person for the general community focused on mental health awareness, wellness, trauma and resiliency, and suicide prevention. Trainings are free and available every month. In total, for fiscal year 21-22, over 1,800 participants attended the 72 trainings that were offered. PEI funds Up to Riverside, a mental health awareness campaign that markets behavioral health messaging and materials to the general community to reduce stigma around seeking behavioral health care. In partnership with the Coachella Valley Behavioral Health Collective, PEI utilized the existing Up to Riverside campaign to tailor outreach to the farm worker community in the Coachella Valley. A new landing page was created on the website, along with downloadable and printed materials in English, Spanish, and Purépecha. In addition, stakeholders have increasingly expressed concern about substance use, especially among youth. PEI joined with our Substance Abuse and Prevention Program to expand the Up to Riverside campaign to include strategic substance use and prevention education for parents and providers of youth services. The campaign educated on the effects of substance use on the development and social-emotional wellness of youth. The new page has been added to the website. You can find it at uptoriverside.org. Family Resource Guide is also available and downloadable. Both regional data and stakeholder voices have indicated continued concerns over suicide deaths in Riverside County. PEI continues to increase planning in this critical area. PEI supports the Inland SoCal Suicide and Crisis Helpline. The helpline is a 24/7 crisis and suicide prevention telephone line that now also serves as the community's point of access for the RUHS Behavioral Health Mobile Crisis Response Teams. These mobile teams, as part of the CSS component, provide behavioral health professionals in the field to people in mental health crisis. The Suicide Prevention Coalition, an alliance of both county and community human service agencies, launched a new website, www.rivcospc.org, where you can keep up to date with scheduled meetings, events, and trainings, and learn how to get involved in Riverside County suicide prevention efforts. In partnership with the Suicide Prevention Coalition, PEI formed a relationship with the Trauma Intervention Program, or TIP. TIP volunteers are specially trained to assist people who've experienced a traumatic event. Family and friends of someone who died by suicide are at higher risk to attempt their own suicides. TIP volunteers received specific training and materials to help suicide loss survivors manage loss and grief. In addition, PEI funded short-term grief counseling for survivors of suicide loss at no cost to residents of Riverside County. This pilot project offers 6 to 8 free sessions to suicide loss survivors through community clinicians who are trained in suicide bereavement. Next is Work Plan 2, Parent Education and Support. This includes services that assist parents and families in building protective factors and reducing risk for the development of mental health problems. Based on community feedback regarding substance use and prevention, as well as supporting parent-child relationships, PEI will expand Guiding Good Choices, or GGC, an evidence-based 5-week parenting course for the parents of youth ages 9 to 14 years old. GGC targets parents of middle school age youth countywide and focuses on the prevention of substance use and other problem behaviors. The expansion will increase the number of families served. This will be a future funding opportunity through the request for proposal process. The next plan highlight is from Work Plan 6. Work Plan 6 is Trauma-Exposed Services. This provides services to reduce the negative impact of trauma for individuals, families, and the behavioral health service system. Cognitive Behavioral Intervention for Trauma in Schools, or CBITS, is a school-based group intervention for grades 5 through 12 that has been shown to reduce post-traumatic stress disorder and depression symptoms in children who've experienced trauma. This program has been offered in Riverside County since the PEI plan was first approved. New contract providers have been added, and services will expand to include the Coachella Valley Unified School District. Additionally, PEI will expand this model to include Bounce Back, an adaptation of the CBITS model for elementary school students in grades K through 5. Community feedback and impacts from the pandemic highlight the need for trauma support to the elementary school population. This program is provided in school settings. This will be a future funding opportunity through the request for proposal process. That concludes my review of the PEI plan highlights. You can read the entire PEI plan in the posted MHSA draft plan, which you can find by following the link associated with this video. If you have any questions or want more information about prevention and early intervention, please email us at pei@ruhealth.org. Thank you. Up next is Leah Newell, the Social Service Planner for the Innovation Component.
Thank you, Diana. Hello, my name is Leah Newell. I am the MISA Innovation Lead. The innovation component of the Mental Health Services Act works much like a large research project. These plans are designed to advance knowledge in the field of public behavioral health. These are time-limited plans, typically around 5 years, and require an additional approval process to access funds from the state. Our current innovation project, Help at Hand, is a 5-year multi-dimensional project concluding in February 2024. This collaborative effort between 14 California cities and counties was created to determine how technology fits within the behavioral health care system. The vision of Help at Hand is to save lives and improve the well-being of Californians by integrating promising technologies into daily wellness routines and to enhance support for a specific behavioral health treatment plan. We are thrilled about the evolution of Riverside County's Help at Hand project. Over the past year, the project has expanded and grown. Help at Hand highlights include kiosks. Kiosks have been installed in waiting areas throughout Riverside County and serve as points of service navigation and education. Here you can also find a link to the MISA plan and how to provide feedback. The kiosk experience is a great way to locate useful resources and support at your fingertips. You can find kiosk locations at the kiosk map locator on the Help at Hand Riverside page. Also, Help at Hand features the Take My Hand live peer chat, which provides peer-to-peer live chat interfacing using real-time conversations for people seeking non-crisis emotional support. The chat is open and free to the Riverside County public, age 16 or older. The online chat works on a PC, laptop, tablet, iPad, and smartphone, or can be accessed at a kiosk or directly online at takemyhand.co. Take My Hand was recognized as a California State Challenge Award recipient due to finding a new, effective, and cost-saving way to provide programs and services to California citizens. Take My Hand will soon be available as an iPhone app. Next, Helping Hand, in collaboration with the Center on Deafness Inland Empire, known as CODI, deployed a deaf and hard of hearing needs assessment survey to improve mental health services for deaf, hard of hearing, and late deafened communities. A survey is currently available through the CODI website at codie.org to collect information from this community. The app for independence, referred to as A4I, was added to the suite of Help at Hand programs. A4I is a mobile app used to support the recovery process of individuals living with schizophrenia or psychosis. A4I tools include tracking treatment progress, providing medication reminders, and can help the user discern between auditory hallucinations and environmental sounds. Riverside County's pilot team is the first team in the United States to utilize this emerging healthcare technology to create an umbrella of caregiving that involves all parties involved in treatment. The technology is used in conjunction with other forms of traditional treatment such as therapy or medication. Clients and caregivers collaborate and are kept in sync with updated information. Our participants continue to express positive feedback about their experience with A4I. In March 2023, our A4I pilot care team earned an A4I Digital Therapeutic Certificate for participating in this innovative pilot program. Help at Hand also offers the Recovery Record mobile app in close collaboration with our trained eating disorder therapists. The Recovery Record mobile app supports our consumers challenged with intensive chronic eating disorders. To date, 11 participants are part of this program pilot. And in early January 2023, Riverside County began a county-wide marketing campaign promoting man therapy to combat mental health stigma among men. Men are traditionally difficult to reach regarding behavioral health care, and as a result, are more likely to experience the consequences of untreated behavioral health challenges. This innovative campaign gets working-age men to think differently about their mental health and take action before they ever reach a point of crisis. Man therapy provides serious behavioral health information in a lighthearted manner and encourages site visitors to take a head inspection, a free, anonymous, scientifically validated online self-assessment. As of March 2023, 491 self-assessments have been completed countywide. Look for our engaging billboards in each of the 3 regions located on local main freeways. Help at Hand also includes the Whole Person Health Score. This health score gives Riverside University Health System, RUHS, patients and their care team an overall health assessment that is accessible and easy to understand. The goal is to help individuals take interest in improving their overall health by looking at 6 domains of health. Uniting with Dr. Jeffrey Leon, author of the Whole Person Health Score, and his team, the Help at Hand Innovation Project is working to digitize the tool and automate the distribution via text and email. A pilot was implemented in mid-March 2023 at the Corona Wellness Clinic. March 2023 featured another rollout, a partnership with Dr. Stephen Lopez and Dr. Alex Kopelowitz, La Clave project directors. Designed to inform the Latinx community to seek early treatment for serious mental illness, we have brought the La Clave message to Riverside County, educating family and friends to understand and recognize the onset of serious mental illness, improves early access to care and overall prognosis. LaClave content will be available in the Take My Hand mobile app and in behavioral health clinics countywide. More information can be found at uselaclave.com. And finally, digital mental health literacy has been a commitment by the Help at Hand Innovation Project team since inception and has continued throughout the development of the project. With brief, basic skills, video tutorials, we're empowering communities to make informed decisions about how they engage with technology, safely and privately access virtual tools, browse safely, avoid phishing and scams, create and manage passwords, and use public Wi-Fi safely. Information is also offered in American Sign Language. We have also joined with Painted Brain, a community-based organization that uses art, advocacy, and enterprise to create lasting mental health solutions. To bring digital mental health literacy training for staff to teach consumers to use smartphone devices, about online security, and promote the use of wellness apps. Lastly, I would encourage you to visit our Help at Hand Riverside website at helpathandca.org/Riverside to learn more about the range of Riverside County offerings that connect our community members to care and promote wellness in our county. We are looking to incorporate innovation component success into the overall RUHS portfolio of care. We are currently developing new innovation plan proposals with a goal to have a new plan in place by the beginning of 2024. Thank you. And up next is Nisha Elliott, the manager of the Workforce Education and Training component.
Thank you, Leah. The Workforce Education and Training WET component of the Mental Health Service Act was established to address the ongoing workforce development needs for public behavioral health departments. The authors of MISA realized that even the best MISA programs are just words on paper without a caring and committed workforce to implement them. Our mission is to promote the recruitment, retention, and training of qualified staff, while also supporting the advancement of recovery-oriented practice skills of those who serve our consumers and families. WET values a diverse workforce that reflects the membership of our unique communities. We strive to reduce service disparities by improving cultural and linguistic competency and by encouraging and supporting members of our diverse communities to pursue public behavioral health careers. WET also values the meaning of inclusion of people with lived experience as consumer, parent, or family members into all levels of employment within the public behavioral health service. To achieve our mission, WET established 5 work plans with corresponding strategies and actions. Those work plans are workforce staffing support, training and technical assistance, career pathways, internship and residency, and financial incentives. Today, I will share some of the highlights from the last year. WET worked to improve staffing in our units. This was done by working to fill all the vacant positions, from manager, that's right, I'm new, to office support staff. This was very important for the plan, implementation, and unit functioning. COVID brought the need of virtual and remote training to the forefront. And as we enter a post-COVID world, we also need to take advantage of these technologies to create hybrid teaching opportunities. This allows us to utilize a combination of learning formats, reduce travel for employees at a distance, and optimize learning modalities. Considering both virtual and in-person training formats, the Staff Development Officer over training was able to organize a training schedule that offered 302 continuing education units and 26 trainings focused on advanced behavioral health topics. Also, as the state ventured to modernize the Medi-Cal service system with the onset of CalAIM, we needed to integrate these changes into direct practice understanding. The Layman Center, or TLC, a teaching program in the WET plan, updated their foundational training to be consistent with CalAIM's rules and regulations. TLC also expanded their services by adding supports for all employees that were previously only available to student interns. These trainings and coaching enhance clinical development and standardized care. In addition, WET developed 5 new department staff to serve as trainers in nonviolent crisis intervention. Developing our own trainers saves money and provides more timely access for staff to learn this evidence-based practice and effectively managing agitated or escalating clients. WET continues to develop a refine the supporting infrastructures to bring evidence-based practices to our clinics. These are proven therapies that have data outcomes for good mental health outcomes. Some of the evidence-based practices include dialectical behavioral therapy, trauma-focused cognitive behavior therapy, and eating disorder treatments for both youth and adults. The department has trained over 400 clinicians to practice these modalities. Based on stakeholder feedback, the practice of eye movement desensitization and reprocessing, EMDR, was added just this year. 30 department clinicians countywide are currently being trained. Most mental health practitioners stumble into their careers, but with the right support and guidance, we can help students see and develop career pathways into public behavioral health service. During this past year, we continue to collaborate with UC Riverside School of Medicine, Norco College, Val Verde Unified School District, and Vista Del Lago High School. These collaborations allow WET to share a proactive role in such activities as a Careers and Behavioral Health Symposium, classroom presentations on mental health topics, a wellness fair, and our first ever virtual Careers and Mental Health workshop in which over 100 high schoolers participated. Our collaboration does not stop there. We continue to support and develop affiliation agreements with numerous academic institutions. The WET Graduate Internship Field and Traineeship GIFT program continues to be one of the most competitive internship programs in the region. In this past academic year, the GIFT program coordinated internships for 32 master's and bachelor's level students countywide. 35% were bilingual Spanish, and many had lived experience as consumers or family members. These graduating interns become a prime candidate pool for new department therapists. But their training needs don't stop upon hire. These new therapists require 3,000 hours of clinical supervision and have to pass state licensing requirements. WET's Clinical Licensure Advancement and Support class program was designed to support department journey level therapists gain clinical licensure. Applications to this program have increased over the past year. 32% of that cohort were bilingual. In this past year, the program assisted 15 participants in passing their state exams. National research indicates that public mental health service systems experiences frequent staff turnover, especially within the first 2 years of hire. Financial incentives such as loan repayment programs that require a service commitment are successful incentives to retain much needed professional staff. WET coordinates financial incentives for both student interns and employed staff. This year, 60 staff were approved for state administered awards amounting to $10,000 each. WET has been described as just the training unit, but as you can tell, there is so much more to our workforce development planning. We are invested in growing our department by analyzing existing workforce data and tailoring target development strategies to manage recruitment and retention. We know that the greatest path to wellness is a partnership between clients and provider. That takes trust, and trust is earned by an ongoing, compassionate relationship with a well-trained, competent practitioner. WET believes in our workforce because WET believes in the power of our services. Thank you. Now, I return you to David to review the Capital Facilities and Technologies component.
Thank you, Nisha. The final component is Capital Facilities and Technology. This component funds new buildings or information technology to support the infrastructure of service delivery. One of the current capital projects is the renovation of the 25-bed permanent supportive housing property for homeless consumers in Riverside called The Place. The Place has 24/7 on-site supportive services for homeless consumers who experience serious mental illness. It was originally opened in 2007. The renovation will allow for much-needed building upgrades, increased bed capacity from 25 shared room beds to 33 single-room beds, and increase the size of common living areas and the group treatment areas. The renovation is scheduled to complete in December of 2023. The next capital project are the Wellness Villages. Our RUHS-BH Wellness Village model will sustain a full-service behavioral health care campus that serves as a safe, monitored, and therapeutic community and living space, while simultaneously delivering high-quality, person-first treatment for behavioral health. The villages will be architecturally designed and landscaped and offer a full continuum of behavioral health care in one location. The goal is to build a wellness village in each of the 5 supervisorial districts. Our RUHS-BH has initially identified 2 locations, Hemet and Coachella. The space originally found in Coachella did not receive final City Council approval. We are still pursuing collaboration with the City of Hemet. Each village would include various programs within the behavioral health continuum of care model, but could vary within each district to tailor individual needs of the surrounding communities. Programs in each campus could include crisis residential treatment, mental health rehabilitation, children's mental health urgent care, children's residential mental health care, substance use services and recovery residences, supportive housing apartments, integrated outpatient clinics to include behavioral health and primary health care services, and vocational services. The vision is to enable consumers and their families to move through the campus continuum of care from most intensive oversight and treatment activities to decreased therapeutic contact, enabling consumers to prepare for a self-sustained recovery grounded in their own community. By delivering the right level of care at the right time and expanding service levels, this model can save cities and the county millions of dollars annually, making a long-lasting impact on the community through complete health, balance, and societal reintegration. Stakeholders have requested more accessible services for children. This campus of care would include an urgent care for children and teens struggling with urgent emotional or behavioral concerns. Also planned is a children's residential treatment facility providing inpatient crisis stabilization, medication, monitoring, and thorough evaluation services to determine the type and intensity of additional services for children and teens. This facility will include a separate kitchen, recreation center, and playground. Housing and support will be available for parents and caregivers whose children are receiving treatment. Our RUHS-BH has submitted several grant applications in an effort to leverage and braid various funding sources. We anticipate construction will conclude by the end of 2026. And that concludes our presentation today. Thank you for participating in this year's Riverside County Mental Health Services Act Annual Update. Don't forget to click on the link for more information, to complete an online feedback form about the plan, or to use the MISA Plan Feedback telephone line if you prefer to leave recorded feedback instead. Be well.